I see Linda and I see. Okay, Linda. Welcome, everyone. Miss Linda, we're good to go.
Oh, okay. All right, great. Good evening, everyone, this evening. My name is Linda Gray. I'm the Diversity Outreach Coordinator for ANWEP, Texas COVID-19 Project. Welcome again to one of our community conversations about the COVID-19 vaccines, which have shown to be highly effective at preventing and mitigating severe disease from COVID-19. And so through ANWEP USA, through the project, we have project leaders across the state that has created a culturally safe space for African immigrants, communities of color, Black, African Americans to connect, network, and have their questions about the COVID-19 vaccines answered without the fear of social stigma, which is one of the major deterrents for not taking the vaccines. This presentation will be very informative this evening and effective in educating all of us about the COVID-19 vaccines, intervention preventions, and other concerns. And tonight, before I pass the mic to Ogechi, I just want to be able to give a few housekeeping webinar tips. In other words, mute your mic unless you're speaking. Be sure if you have any questions throughout this presentation to be sure and type it in the chat as we go, because we would definitely be able to answer and respond to each and every question. Also, let's be mindful of the time, allotted time for this great presentation this evening and discussions during our Q&A. So now I would like to pass the mic to Ogechi, who is the founder and project lead director for the Texas COVID-19 project. Ogechi.
Thank you so much, Miss Linda, for that very warm introduction, and welcome everyone to our monthly community conversation around COVID-19 vaccines. ANWEP, as you already know, is actively working to educate our African American communities in the state of Texas about the importance of getting vaccinated against the COVID-19 virus and protecting ourselves and our families from this very dangerous virus. With us today to discuss the impact of COVID-19 on our mental health, particularly the vulnerable population, which would be the children and the seniors in our communities, is Mrs. Augustina Obi, who is a nurse practitioner. And today, before I introduce her, I want to just read a little bit about her bio, her background, so that we can get to know her more intimately. Augustina Akudo Obi is a wife and a mother of 5 children, 2 boys and 3 girls. She's a Nigerian, currently living in Michigan. She graduated from Eastern Michigan University with Bachelor's of Science in Nursing, and later went on to further her nursing career at Madonna University, Livonia, Michigan, where she obtained her Master of Science in Nursing as an acute as an acute care nurse practitioner. And she has been board certified as adult gerontology acute care nurse practitioner, AGA CNP, in August of 2019. She started her nurse practitioner career with Wayne State University Physicians Group, same year that she graduated, rotating between Detroit Receiving Hospital as an internal medicine NP, nurse practitioner, and Carmonos Cancer Institute as a medical oncology and hematology nurse practitioner, serving the underserved population in Detroit, Michigan. About a year ago, she transferred back to St. Joseph Mercy Hospital, Ann Arbor, Michigan, where she's currently working as a neurosurgery nurse practitioner. Prior to her nurse practitioner career, she's been a critical care nurse at St. Joseph Mercy Hospital, Ann Arbor, for many years, mainly in the medical intensive care unit. There, she served in different leadership roles and was the lead mentor in the medical ICU, helping nurses and other healthcare professionals, especially new nurses, navigate their role, meet/exceed their expectation, and try to prevent burnout syndrome that comes with working in the critical care setting. Wow, this is so packed. I am very, very, very happy, and it's a great honor to have you today, Mrs. Augustina. Thank you for all you do for our community. Thank you for being a great mentor and role model to our younger generation. And we welcome you today. And, I want to, everyone to welcome her as she takes us through this topic that is very, very important and critical to the success of our project. Welcome, Ms. Augustina.
Thank you so much. Thank you, Ogechi, for having me. Thank you, Linda. Nice meeting you. First of all, Ogechi, I just want to thank you for the great work you're doing. It's not easy, and you have taken a lot and you have accomplished a lot. And this platform, thank you for giving me this opportunity to speak on this topic. We all know what COVID has done, and especially to the underserved population, to the African American. They suffer the most underserved communities too. They suffer quite a bit. And your program, ANWEP, your outreach, I think God is using you to do great things. Thank you for giving me this opportunity.
Thank you. I appreciate it.
I chose this topic today because, COVID impacted so many, everybody, young, middle-aged, young adult, older adult, everybody. But it felt the children and the elderly are the most vulnerable to begin with, even before COVID, because they tend to be dependent on others. And then when COVID happened, everything shut down. It's like their world turned upside down, don't know how to feel, don't know where to go, don't know where. So the impact was heavily on them. Like I said, it affected everybody, frontline workers, nurses. I saw everything firsthand, but the children and the elderly need a voice, and I feel like their voice was lost.
Yes.
And most of them are still finding their voice. So, talking about this, shining light on this, every little bit of help, every little bit can go along with helping them find their voice and they'll get back to their, new normal.
Yes.
So I am so happy and grateful to be talking about this. All right. So I think we can start now. Let me share my screen. Oh, it said hope disable the participant screen sharing. Ogechi, can you enable my screen sharing?
Yeah, so I made you a co-host so you can have the ability to share. Let me know if you can see it now.
1 second. Okay. So like the topic said, as the impact of COVID-19 on the mental health, especially the vulnerable population, the children and the young adult and the elderly. For the past 2 years, we've been dealing with this COVID. It's been like going on the third year now, basically.
Mhm.
And so many Americans were, contacted this COVID-19 virus. Over 1 million deaths in the United States. Confirmed cases in the United States were about 98 million, which is significant. Texas alone, your state's primary state that the ANWEP organization is primarily at, had over 8 million cases. The effect of COVID-19 on everybody, it was very unprecedented. When it started, we didn't know what COVID was. We didn't know the impact. It just hit us all of a sudden and everything was shut down. The COVID has so many effects on different areas of our lives. The economy, with the shutdown, most people lost their jobs. Most people lost their way of livelihood. It had significant impact on our physical well-being. The elderly, especially the children in school, they participate in sports. They, get out of just ordinary recess that they had in school do a lot for their physical well-being. And the elderly, they can take a walk. Most of them go to community centers. Most of them, go out to be with their friends, visit family. That's the way, most of them interact with others because they're already retired, alone at home. And then with the shutdown, their physical and mental well-being were very affected. Their social life, their emotional status, their psychological well-being. They were worried about their loved ones. Some of them, majority of them loved their loved ones during this COVID. So it had significant impact on their overall well-being. Prior to COVID, mental health as a general in the United States was already taking a hit. Before COVID, we were already experiencing less resources, fewer facilities to handle mental health. That was already on the rise. United States was already suffering from prolonged decline in the mental well-being of the citizens before COVID. And there was also limitation, like there was so many shortage of mental health resource facilities before COVID. There were short staffing and mental health caregivers. My state in Michigan, especially prior to COVID, the mental health hospitals and facilities were already full to capacity. So you can imagine with COVID and the impact it had on it, the facilities they were already understaffed, not even less to existence because of the stigma we have in the mental health. They were beyond capacity and there were no place for people to go to. And also with the shutdown, people that were already suppressing their mental health and managing their well-being, getting around, going to work, just to go day by day, by having that human interaction, that was also taken away. So it also compared to the problem. So given the already rising, mental health population, then COVID, added more to that. So it's one area that actually had a significant rise and it had significant impact on people and people suffered a lot. And most are still suffering in silence, which is why this outreach, whatever we can do to help to mitigate this, it's very, very vital and very necessary. So there was some surveys, this United Census household pulse survey data they collected data from April 2020 to April 2022, and they tracked that mental health has evolved and increased up to 3 million among United States citizens. I don't have the I don't have the exact number prior to pandemic, which was already high, but taking it up to 3 million, that's quite a number. And also the same survey found that anxiety, depression, and worry were significant among most people. They were anxious of what's going to happen. Because like I said, when COVID happened, we didn't know what it was. The media was already showing the number of cases, the number of deaths, and most of them lost their loved ones. They were worried what's going to happen to them. Well, when are they going to contact it? If they contact it, again, the hospital were full to capacity. The anxiety, normally the people, general population, if you're not in the medical field, don't work in the healthcare, most people have anxiety going to hospital to begin with. And now they have this deadly illness that will take them to that hospital. And from what the media was showing and publishing was that, majority that goes to the hospital were not coming back. You can imagine the anxiety people were facing. And losing loved ones, depression setting. With anxiety, depression, that comes worry. You worry about every move, how you're going to go take your next step. Am I going to be okay in the next morning? I saw my neighbor yesterday. Am I going to be fine tomorrow? So the worry, the anxiety, it just compiling and kept going. Also, then let's focus on the mental health of the children. The mental health, America published a study in 2021 that the youth in particular, their mental health has worsened during the pandemic. Many studies have shown that school-age children have had increased anxiety, depression, loneliness, stress, fear, tension and apprehension. Again, the fear of unknown, where you become very apprehensive if you don't know what's going to happen next. Somebody cough next to you. Do they have COVID? Am I going to get it? Are they going to be okay? So that apprehension, then it turns to anger. They get tired of everything, confusion, and then worry. It has also been noted that children with chronic illness, are more vulnerable to experience mental health with this, which it's a given. You already have some condition you're already worried about, like kids with cancer, leukemia, kids with already, known breathing problem. Then you are now afraid, like, is my asthma going to exacerbate? If I get COVID, am I going to be okay? Everybody's dying from COVID. So the worry, the anxiety, it took a toll on children quite a bit. Again, their sports, some of them find solace in hanging out with their peers. I have kids, my kids are very athletic. They play sports. So they were very depressed, very angry sometimes because they're not able to hang out with their friends. My son was a senior in high school. He was looking forward to going to college. He was looking forward to signing, to the school. He had offers to go to college to run for them. He was looking forward to that. Everything was shut down. So at some point he became angry. And I understand that. Some kids' sports is their outlets. Some of them, artwork, dancing, acting, singing. I have a singer in my house. She will use her pot and pen and do her microphone. But, she was singing in school. So all this were taken away. So kids felt, the significant impact of this. So it just kept compiling and going. And it took a good mental health toll on the children. Also, there's some data that I found that showed that 38% of high school students report that they experienced poor mental health during this pandemic. 44% of them say they persistently felt sad and hopelessness. Like I said, everything was taken away from them, shut down all of a sudden. Some of the severe challenges that was reported in the pandemic with this study is that more than 55% of them reported emotional abuse from parents or an adult in the home, including swearing at, insulting them, putting them down. 11% of them experienced physical abuse by their parents or other adults in their homes, which includes hitting them, beating them, kicking them, physically hurting them. More than 29% of them reported that their parents or an adult in the household lost their job. Again, we shut down all of a sudden. Many jobs were lost. So many parents worked remote. You know, when you have the parents, some of them that lost their job are worried about how they are going to get their income or food for the next day, the children at home. And I don't know about you, my children, when they're at home, I feel like they eat more, you know, because they're constantly at home. So they're looking for something. They're not out there. They're not like expressing or like relieving their anger or pressure or their energy somewhere else. So, you know, they tend, I'm sure, being a kid, some parents were already apprehensive, anxious. They take out their frustration on children, which results in abuse. So now let's talk about the elderly. As we know, majority of the older adults had a higher risk of contracting COVID-19. 80% of the reported deaths in the United States were among older adults 65 years of old or older. And also older adults, you know, accounts for COVID-19 accounts for mortality of over 1 million lives in the United States, and 790,000 of them were older adults. The rate of anxiety and depression has increased in the older adult during the pandemic. And some factors that affect this, I mean, most of the older adults to begin with, they already have comorbidities. One thing I found first class in working in the COVID-19 period was that most of that with chronic respiratory problem and diabetes were mostly affected. And majority of the population in the United States with chronic respiratory problem like COPD, emphysema are all older adults. Diabetes, older adults 65 years or older account for more than 80% of diabetes and all. So they are already vulnerable to this COVID-19. And now, again, they are frail health, they have cardiac problem, everything just keep compounding. So they're already at risk. So that it makes sense why they are the most affected and they had the highest death rates. That being said, there are also some older adults that left that were not affected, but witnessed their loved ones, their siblings, their spouse, you know, their friends die from COVID-19, which this also, on the other hand, have a significant impact on their mental health. So another thing is, I know lockdown and social distance were put in place to reduce the rate of transmission, especially in the elderly. The children, they do get the COVID-19, but their severity is less. But the elderly, given their comorbidities, they tend to have more severe and significant impact from COVID-19. So the lockdown, yes, it was put in place to help reduce the spread of the COVID-19, but on the other hand, it isolated them. It made them feel more lonely. It made them feel alone. And that feeling of loneliness and alone triggers a mental health, like the fear, the worry, the anxiety, the anger, you know, because when you don't have an outlet to like channel your experience, channel your feeling, you're by yourself. Sometimes the people they tend to call to or go to have passed away from the COVID-19 infection, or their kids are already worried about their own children, their grandchildren, and it's just like a snowball effect. And it kept compiling. So they tend to isolate more. They tend to retract and withdraw But being alone, like when they are by themselves, it just make them feel worthless, not wanted. It just triggers so many feelings for them. Social isolation also associated with increased mortality and decreased quality of life in older adults. Let's face it, if you're by yourself and alone and less interactive, you tend to go in a downward spiral. You can imagine an older adult already have all these comorbidities. They're worried before this, they even worry about going to their doctor, how their COPD is going to handle them. If they don't take their asthma medication, how it's going to affect them. If they don't go to their, take their daily walk around the house or something, how is it going to affect them? Now, all those are very limited. Some of them don't know how to walk the Zoom like we're doing, and they have to see a doctor via Zoom. You can imagine what they were processing. To get to the doctor to begin with, it's already a problem prior to pandemic because most of them don't drive. And now you have to compile this of not able to talk to the doctor and express to them what they feel or how they're doing. Then they have to figure out how to work on this technology that they don't know nothing about. So it took tolls on them too. Again, like I said, death of the loved ones, they're already feeling sad and lonely from that. Some of them were unexpected deaths. And also the feeling of helplessness. I'm sure some of them wants to help, but they know that when they go out there, they're exposing themselves more. And then the risk of getting the infection and coming back and getting sick, it just put them in a spiral and downward spirals. What can we do to help this? Both the elderly and the children, I think getting vaccinated is a starting point, which is where ANWEP, like what you're doing, spreading this awareness. We already know that, vaccination, it's an added layer of a security prevention, like a security blanket for us. So getting vaccinated, you have that protection. You can go out now. You can associate with your friends. You can go out to your normal activity. Most of them that have their social life that they do, some of them we are still walking and volunteering. So vaccine will give them that opportunity to go back out there to help get back to at least somewhat to their former social normal life. Simple act of kindness. Just a simple, how are you? How are you feeling? How can I help? How was your day? Isolation it's a sad thing. Most of them were home alone, isolated by themselves. When you see your neighbor who you know is elderly and live by themselves or lost a significant other during the pandemic, just simple act of kindness in the morning. Good morning, how are you doing? How are you feeling? Or you come back from work as you're driving in your driveway, you see their trash can in the driveway, just pull it up to the front so that they don't have to take that extra, because again, our elderly, they're at the high risk of fall. You bring in that trash can close to the garage door or the front door, saves her a few steps. She could trip and fall trying to bring that in. They're frail already. How can I help you? I live in Michigan where we have a lot of snow. You shovel your driveway, you see your elderly neighbor who can shovel, but their driveway is all full. Just at least shovel a sidewalk path where they can get through. You don't have to do the whole thing because they can slip and fall in the snow. They're not going to be able to shovel that, but if you make a path for them, they can at least get in and out of their house without the fear of slipping and falling in the snow. Another way we can help is as a healthcare worker, this is mostly for healthcare providers, look for signs and symptoms of mental health. In our community, Nigerian, African American as a whole, I think we tend to suppress mental health that is non-existent. I mean, I don't know, Geshi, most of you from Nigeria can relate to this. You say you're depressed in Nigeria, God forbid. You know, we tend to have we tend to have this bad stigma about mental health. It's real.
Yes.
It's real. And when we start finding it earlier on, doing something to help it, mitigate it earlier on, we tend to have control of it. Then when we let it go beyond the normal and then spiral, then it's hard to control.
Yes.
Sometimes the elderly, they experience, their mental health comes in the different signs and symptoms. It doesn't have to be manic. It doesn't have to be aggression. It doesn't have to be, it could be just silence, quietness. They're sad. They tell you ask them, they say, I'm tired. They're tired all the time. Or they come to you, they say, I don't sleep well, because they are worrying. And sometimes as healthcare professionals, they come, oh, I don't sleep well, or I'll give you Ambien. This is not an Ambien problem. You know, they say like, oh, I have had time concentrating, I've been forgetful, because they are worrying, because they're scared, because they are sad. When we take time as healthcare providers to find all the subtle signs and like dig further, help me understand why you're sad. Tell me what you feel when you say you're tired. Tell me what you do before you go to bed. Tell me how you feel that makes you not. Just explore a little bit more. And when you try to explore more, you make them feel like they are cared for, they are wanted, they are loved, they tend to open up more for you. But when they come to us as a healthcare provider, it's like, oh, I can't sleep, oh, I'm tired all the time. Then you start like, oh, take this medication. Okay, maybe it's because of this. Listen to them. Try and find out more. And when you tell them, help me understand more, tell me more about this not sleeping well, they tend to open up more for you, and then you tend to see more of what's going on in their life. But if they come and you just look at it as a normal, not trying to explore more, they will shut down and the problem continues and not taken care of. And then it will continue piling on and their health will start deteriorating. Again, as healthcare providers, we can use cognitive behavioral therapy, social therapies, community resources. There's so many. ANWEP is one of them. I love what you're doing, Ogechi. All those community resources, go to churches, organize health fairs, organize activities for the kids, for the elderly. Like where I live in Ypsilanti, our Ypsilanti Community Center here, we have good, community resources, which was another thing that was shut down in the pandemic. My kids, they participated in those community centers. My girls did dance there every Saturday, Thursday evening, Tuesday evening. They go to dance there. They love hanging out with their friends. So community outreach centers like that, we have what we call the 50 and Beyond program. It's for 50 years and older. It's in the same center where the kids, they have basketball, they have soccer, they have different outreach that you can. Sometimes we have organizations like ANWEP come on a Saturday where the girls are doing dance. After dance, they will have like a coloring fair. The older adults, they have art shows will come in, they'll have like an art fair. Let's be honest, most of our elderly, they know how to do stuff with their hands. If you create that environment where they can bring out their artwork, like something they need, they be to showcase. Even if they don't make money, even if they don't share, but at least they showcase it brings more life and joy to them. Like the 50 and Beyond program, I'm saying, when the young kids have their dance recital in April, they put up the 50 years and older, they put up a dance show, they dance on stage with the kids. Those are like some kind of resources, outreach that we can do, to help. ANWEP have like community fairs, like the one I saw today, you posted, Ogechi. Things like that, you bring people together. When you bring them together, even while you're there, we know that the African Americans, we are very resistant, and we are not getting the vaccine as much as I would like them to. But when you do fairs like that in a community center, you can bring a healthcare provider there. You bring a vaccine, make it readily available for them. You can even bring a mental health counselor to sit on the side, talk to me, help me understand how is school going, how's life going, how are your grandkids. From asking them things they love, they will open up to you. You will be surprised. You will be surprised. I worked with a lot of healthcare providers during the pandemic. That's another topic for another day. Mental health of the frontline staff is another topic for another day. I did a lot of mentorship with a lot of my nurses during the pandemic, because this happened in the middle of my transition from bedside nursing to NP. I just felt I couldn't abandon my nurses. So I was doing both. Some days I would leave work and I would be in the locker room, because you have to change off everything you used at work, put your clothes in a bag. Thank God the hospital provided scrubs for us. But some days I will be in the locker room because I would do charge. I have to give report. By the time I finish, I'm almost like towards the last few to leave. And I'll go in the locker room to change, and I will sit there. I'll hear a cry in the bathroom. I can't just go home when one of my nurses is crying. I will wait, and when they hear that somebody's there, they don't want to come out because they feel embarrassed. That's suppressing your mental health. But I will wait. They come out like, are you okay? Just a simple hug. Just a simple knowing that we're in this together, can help it. So, like I said, little acts of kindness can help. Community resources like ANWEP is doing can help. Okay, you keep doing the good work you're doing. It's very vital. Every little bit of the outreach you're doing helps, one day at a time, one person at a time, one resource at a time. So keep doing what you're doing. Then the children, what can we do to help children? Again, we were locked down, all in our home, very isolated. Children turn into games and they learn all sort of things that we don't want them to learn online, So there is this virtual volunteerism that I found online, and a friend of mine actually used it. She was a volunteer there. You just go to this website, engagepointsoflights.org. You put in your area, your zip code, what you're interested in. If there are volunteer opportunities in your area, it will come up. It can be mentorship. It can be talking to kids, as even what my daughter actually received like a mentorship on how to write a resume when she was going to college, how to do resume. Career guidance too. You just put in what you as a mentor is interested in. You will find opportunity in your community, in your area, and you'll be surprised. It could be little kids that just want to talk to somebody. So many children don't have, responsible older adults in their home. And as we know, African Americans, we're kind of on the downside of that, sometimes we don't have good support at home. Kids like this, like the big brother, big sister, you can be one of the big brother, big sister volunteers, that help. Arranging for children, you can arrange a virtual movie watch with their kids, their friends. Like, hey, call up the parents, message them. My son is at home, they're feeling lonely. I know this person is in their class. Are you available on this day so that we can arrange a virtual movie? They watch it together. My youngest is 9. I know in the pandemic, I'm one of the few that still have the home phone. I let him call his friends. Sometimes he will be on the phone with a friend. They're not talking, but they're doing their schoolwork. They're playing on the phone. They're telling each other what they're doing. And then you see a period of 5-10 minutes. the phone is on, nobody's talking. And I'm like, oh, are you done? No, then they call, then they come back again. I know, I mean, yes, the minutes are going, but when you have an unlimited, talk and text on your phone, let them use your phone, call up their friends, call family members, check on your neighbors. If you have a neighbor that have a kids of their age, you can arrange, safe, play dates, come out in the front yard, they can do activities together, they can color together, they can ride their bikes together. Another thing that COVID also brought that I had to witness that, I don't know, I would say my ignorance was shortage of food in so many homes. Hunger is a real thing in our community, and I did not realize that till COVID-19. Because I serve as a board member at my kids' school. I'm a school board member, and the amount of children that were hungry during the pandemic was eye-opening. That this school had a surplus in their meal fund because the school was shut down all of a sudden. So we used it to do like a food bank center. Reached out to all the students in the school, come on these days for food. Like we have food available, they come with their baskets. But when you realize the amount of people that showed up, people that are hungry, for me, I was very ignorant of that, and that was an eye-opening for me. If you can donate to a food bank, people are hungry out there. There are so many organizations too that, that are resources like food gatherers. Reach out to them to reach out to the underserved community for food donation. Again, offer mentorship. A lot of our young generation, they could use good mentor. Okay, I can't say it enough. What you're doing on Women in Science, I just love it. I can't thank you enough. Keep shining the light, keep doing what you're doing. You are a good mentor, a good resource for so many. And here are some community resource centers that I found, they're very helpful, mostly for the elderly, but we also have for the young. Friendship line, it's a crisis intervention and non-emergency warm line for 60 years and above. They can call when they're feeling lonely. Somebody will talk to them, counsel them, find resources that around them that they can go to. The other one is the disaster distress helpline. Again, if you're feeling distressed, call. National Suicide Prevention Hotlines. I think it's something every organization should have handy just in case. And also the SAGE National the LGBT Elder Hotline. For food and housing and transportation, there's Meals on Wheels. I don't know. I think Meals on Wheels is nationwide, is it? Yeah, because that was one thing that saved a lot of the elderly in my community. I used to volunteer on Meals on Wheels before the pandemic. Many years when I was at Eastern Michigan University. It's been a long time, but even at that time, most of the elderly, when they see you at their doorstep, the smile on their face is so rewarding. And some of them, when you sit down to talk to them, you will find out that you are the only hot meal they have for the week. So it's a very, very, very great organization. If you have opportunity to volunteer, I will encourage that. Feeding America is another great organization for food bank. Benefitscheckup.org is just to help the elderly, with their benefits, insurance, food stamp, housing, all sort of stuff that they might have problem with. And the Teen Helping Seniors, that's another great organization. I think that's one of the ones that are very helpful in Michigan, especially this time around in the winter time with the snow. The teens in the community, sometimes the churches, organizations like ANWEP organize it. They go out to the community, shovel the elderly's drives. They will make up list of elderlies in the neighborhood and, go and shovel their snow. Also, we have this elder care locator for transport and everything. So ANWEP is another organization that is very helpful to this, you know.
Please
So
add us to the list.
I sure will. I sure will. And this is like some of the references that I found, you know, to help compile this data. Again, thank you, Ogechi, for this opportunity. Thank you for what you're doing. Let's keep shining light on this. Mental health is it's on the rise. It's real. In as much as our community don't want to accept it, our Nigerian community need to do better. We need to do better. Our African American community needs to do better. Our underserved, we need to do better. We need to embrace it, take the stigma out of mental health. It is real and it's affecting so many lives more than we want to accept it. But the earlier we start accepting it, the better and the more, you know, improvement we'll see in it. Thank you so much for having me.
Yay. Thank you so much, Mrs. Augustina Obi. You know, you've totally blown me away with the granularity of your research and your presentation. We've been talking about mental health and COVID and all this and all that, but you know, you just took us through the ins and outs, very detailed, you know, presentation, that there are some things that we even overlook when we discuss mental health. So I am very, very thankful for the opportunity to have you with us. And like I said earlier, it's a great honor. We are all doing great work in our own individual spaces. But when we come together like this, we make even a bigger impact because no one person knows it all. And no one person can do the work. There's a lot to be done. So I'm very, very, very appreciative of the connection. Thank you, Isioma, and for, you know, for this networking opportunity with intellectual powerhouses like Ndidi, sorry, not Ndidi, Ndidi is the other one, the doctor, Augustina Obi. Thank you very, very much. I want to see if anyone here has a question, and I'm going to try to allow people to talk. So if you have a question, please feel free to unmute yourself and ask your question. Ask, and Mrs. Augustina can, you know, respond here in the webinar. You can either type it in as a chat and Linda can read it, or you can just raise your hand or mute yourself and ask.
Can you all help hear me?
Yes, I think I can hear you.
Okay, awesome. I just want to say that I really enjoyed the presentation, and it was so enlightening. You know, we've been talking about how COVID affects, we've talked about women, about the same, while still talking about the African-American population, but just seeing how it affects the mental health and the elderly and the young people. You know, you took us through, you know, the whole process. And I think I enjoyed, I was right there throughout, and I enjoyed, you know, listening and learning and knowing that this thing, it's really important we get this vaccination, and so we can all be healthy and we can just get our lives back to normal. In my office, we're just getting everybody back to work now. Some people are still scared and uncomfortable about it. Some people have come in and they've had to be home for days because they got the virus again. And this time we're not really scared. You know, oh, I think I have the virus. It's positive, but we're not scared. Why? Because they've been, you know, yeah, they've been vaccinated. They're doing the right thing and all that. So we just need to get the people like us to get comfortable as well, so we can save ourselves. We can, you know, live, you know, a more fulfilling life, you know. So this is really good. Thank you so much. Thank you. I enjoyed it. It was so practical. It was talking about families and, you know, so thank you so much. Thank you, Ogechi. Thank you, Linda. Thanks, everyone.
Thank you,
guys for
Isioma.
having
That was a
me.
very great, it's a great input, and your observations are very correct. That's exactly how we felt about the presentation. It was very in-depth. And, she took us through navigated us through all the whole areas of mental health, from the stigma to, what we can do. And I'm particularly thankful for the resources at the end of the webinar, because it's one thing to talk about a problem, but then, offering solutions is what ultimately we want to accomplish, right? We want to be able to figure out how we can address the situation. We just don't want to keep talking about an issue. We want practical ways to help address it. Mental health is real. We can see it every time all around us. But like you said, because of the stigma, a lot of people struggle to open up about it. So we all ought to do a better job of listening, observing people around us, figuring out a way to start the conversation without making the person uncomfortable to open up. I was, during our event, the outreach that we had recently at the, it's called the African American, I think it's Business Lounge, African American Trade and Expo. And ANWEP was on site conducting outreach, engaging with our target population, to discuss their views on the vaccines. Have they been vaccinated? And if not, why are they hesitant? And a young lady walked up to me. She said, I'm not comfortable talking about this in public because I'm one of those people that is very hesitant about getting vaccinated. And I said, why? I said, it's okay. That's why we're here. We've created a safe space for people who look like us to feel comfortable to tell us, give us an honest opinion about, their views on the vaccines. She said, first and foremost, that she doesn't trust that the vaccine, that a lot of work was put into the production of the vaccine because of the, how fast it was developed, that typically vaccines take years and all that. And this one just happened so fast that she felt that it was rushed. And I'm like, well, first and foremost, when this pandemic started, it was a global issue. Typically when, people in the healthcare industry can correct me if I'm wrong, but this is my assumption. When companies try to do research to create a vaccine, they are independently conducting those research. They may not have the amount of funding that the government pumped into this particular one because it's like priority number one to get a solution because it shut down the world economies, education and everything was impacted. So it got everybody's attention and the government pumped money. Secondly, we had technology at our fingertips right now. So things that would normally take years, could take a matter of minutes, or even so. And then there's also the fact that SARS virus, which is in the family of COVID, there's been, right? COVID is in the family of SARS. Maybe I have it upside down. But, there's been like ongoing research prior to the vaccine coming up, to getting a vaccine for those. So it's been around, it's just not been in the forefront because, the pandemic kind of opened up a whole, how will I put it? Not a can of worms, but, brought it up to the top. So we are able to see it. And then I started to ask her, and this is just me talking from not a professional healthcare person, but this is the much I've learned from reading articles from, medical professionals, following the news about COVID, the CDC websites and everything, and some of the training that we've received working in this project. And I asked her, I said, well, if you don't trust that the vaccine is efficient and it was not, a lot of time wasn't put into it, you know, millions of people globally have gotten the vaccines, and you know, it's been like a year since most of us got it and we're still alive. I said, by the way, if all of us die all of a sudden, God forbid, and it's because of this vaccine, which is defective maybe, would you like to be the only person left in the world? Because there's not going to be a lot of people left. I said, she started laughing. She said, oh my God, I didn't think about it that way, Ogechi. I said, yes, because if everybody, say half of the population of the world all of a sudden die because maybe the vaccine is not effective or is bad or anything, you wouldn't want to be the only one left, because everybody you know probably will be gone. And she said, that's a good point. She said, I didn't think about it that way. Anyway, yes, that she's going to get vaccinated. You know, so like you said, talking things through with people help a lot. You know, isolation is not a good thing. And people need to be comfortable to open up. Like, I don't think if she didn't see somebody like me who looks like her, she probably wouldn't be comfortable to tell me, you know, how she's feeling, because she'll be afraid of maybe people saying, oh, you know, like stigma, like, you know, I can't believe she's so ignorant that she cannot get, you know, we are quick to judge. And that is what makes people not to trust people, others enough to really be truthful about what they feel or what they think or their own perspective on issues and what they are going through. So, yeah, so, you know, it was just very kind of like, how will I put it? It's a great opportunity to actually connect to people and hear firsthand what people think and what they feel, you know, about these vaccines. Is very important. Without the vaccines, we will still be hiding in our homes. You know, nobody would want to come out. I think with the vaccines, we're able to at least go out and do things. People aren't afraid. COVID is still very much around and people are getting it, but the impact is not as severe as it was without the vaccines. So people get it, they go about their business, or they get better, and you know, so it is very, very important that we keep this messaging consistent across all our communities, you know, that is important to get protected, and that will give you the freedom that you need to actually go out and socialize and pursue, you know, go about your business as usual. Does anybody else want to add something? And Augusta, please correct me on some of the medical, you know, my medical analysis of the vaccines if I'm wrong. But yeah, go ahead.
Correct. What I want to add, again, she asked you, you took the time to talk to her. That makes a difference.
Yes.
She could have asked somebody, and they, well, if you don't want to get it, you know, they keep moving. But you took the time, you talked to her, you explained to her, you walked her through, and she understood. And at the end, she saw a reason with you. That's also another way, you know. Not only did she see somebody that looks like her, that she felt comfortable to ask, but she did ask you, and you took the time to explain.
Yes.
That's another layer of, you know, getting there towards there. Because she could have asked somebody and it don't make that time, and she will still not get the vaccine.
That's true. That's true. Pastor Riley, you've been very quiet. Do you want to add something before we wrap up? It's 9:05. We want to keep our community conversations under an hour, an hour or under. But this topic is so interesting that I didn't even want Augustina to stop. I'm like, oh my God, I have to learn as much as I can. You know, that presentation is packed. And I hope you'll be generous enough to share that slide with me so that I can share with our members.
We do.
And also, I would like to say thank you very much for the information that you shared. It was really insightful. And I think that our communities and here in Texas will really benefit from that information. And I think that so many people in our communities have that fear of the virus because of so much misinformation. And I think that it takes us, all of us that are on this call, we have to have a commitment to righting the wrong, which is the information that was passed on early in this fight against the virus, that it impacted people no matter what the race, the creed, color, nationality, monetary, bank account, or any of those things. It doesn't matter. And I think this is one of the times where we were able, as a community of people, to come together and work together. And I think that we can see that if we work together as a people, that we can make meaningful change to our community and to those that are in our community that have been impacted based on misinformation, not only about this particular healthcare issue, but also health disparities in general, financial freedom, and a whole lot of other list of things that I think that we can do. But thank you very much for being here. I'm excited that you're a part of sharing that message in our community, and look forward to working with you in the future.
Thank you.
Thank you so much, Pastor Riley. All right, Linda, take it away.
Wow, you don't want me to take it away. You said under an hour. Did you say this? But nevertheless, a great presentation, Augustina. And guess what? As a senior citizen, I am so delightful to learn and get more information. I appreciate the opportunity for you sharing some references that I didn't even know about. And I thought I knew all of the references, but I did not. And so as a senior, it is important for me to be able to relate to other seniors and then give and support. And one last thing, I am so honored and proud to be associated with the Texas COVID-19 project under the fiscal administration of ANWEP. And to all of my peers that we're here and we're working together. And then one last thing, but not least, is we are on target because we have already instituted services for our elderly. We have starting more initiatives to target our elderly, and Texarkana is out front with them providing essential services for our seniors and to impact them and then to help them socially. So again, I want to thank everyone for attending. And then is this the last community conversation for the end of the year? Are we having?
No, we have one that Pastor Riley will be a guest speaker on with a doctor as well in Texarkana, Texas, coming up this month. So I'll be sharing that link, the registration link after this one.
All right,
Yeah.
but thank you, everyone.
Yeah, thank you, Linda. Sorry,
evening.
I didn't mean for you to take it away because we're not starting, we're ending, but I just wanted you to add to the topic before we close. So thank you so much, everyone. Thank you, Mrs. Augustina Obi, for your time. Hopefully when we resume our annual conferences where we honor women such as yourself, who are doing great work in our communities, making impacts in the healthcare space, we would want to recognize you and honor you for the work that you do. So hopefully sometime next year, we normally do our conferences in August. You can come, as an awardee, because we will want to thank you for your contributions to our organization. Thank you, everyone. Did I miss anybody else? Is there anybody here that hasn't gotten the opportunity to speak? Rena Pearson, do you want to add?
Rena is my buddy from Michigan.
Oh, hi, Rena.
Thank
It's
you for
great to
inviting
have
me here
you.
again. I'm actually a Filipino, and I've been listening to Augustine and how she shared everything, especially about the stigma with mental health. You know, in my country, it's something that's not even recognized. You know, we worry about food, you know, surviving everyday daily life. So if you're depressed, we just like put it under the rug. So this is a big information that she shared. And thank you guys for having me.
Oh, you're very welcome. Thank you for joining us. All right, so thank you, everyone. Enjoy your Saturday night. Have fun with your family. Go out. Augustina has told us, you know, ways that we can help mitigate the impact of the stresses that come with COVID. Let's just keep, you know, checking on each other, checking on our neighbors, talking to our children, people are around us, our siblings, and making sure that people are not hiding those feelings, keeping them to themselves. Thank you, everyone. Bye.
Bye.
Till next
Thank
time.
you